Most students spend hours trying to memorize the arteries of the leg, but in the next few minutes, I'll teach you the entire arterial roadmap of the lower limb in a way that's fast, simple, and easy to remember. Blood flow, of course, starts at our heart. The left ventricle of the heart is responsible for pumping all the blood against the systemic resistance into our body. Now, the artery's main job is to transport oxygenated blood from the heart to the rest of the entire body, away from the heart, to supply all the needs that we need from our muscles to our organs to our skin to all the necessary things that we require for bodily functioning. Arteries are naturally more muscular than veins. They have a thicker muscular wall in order to handle the high pressures that are generated by the actual pumping of the left ventricle of the heart. So of course it'll pump it out the aorta, which is we're seen at the top of the heart right here, and we're going to actually follow it down into the thoracic cavity, and we're going to join into the abdominal aorta right here. And this is the major blood vessel that runs right anteriorly to your spine as it travels on down, and it keeps on going until it eventually splits right around your sacrum area. And this is the bifurcation point, and it'll split into the right and left common iliac artery. Continuing with the common iliac artery, this artery will then come down and continue down through the pelvic girdle and split into the external and internal iliac artery. Right now we're going to focus on the internal iliac artery. And so the internal iliac artery, as you can see, kind of splits and goes into the entire pelvic girdle where our reproductive and urogenital systems kind of sit here. It has three major branches that we're going to cover. There are more branches that exist that we are not covering today. So our first major branch that I want to talk about is this guy right here called the obturator artery. As it is appropriately named, as you can see how this branches off and then courses down into the obturator foramen right here. A super important clinical tidbit about this one, I'm going to hide the pelvis here. And the obturator artery sends a branch, as you can see right here, to supply blood to the head of the femur. This artery right here is a branch of the obturator artery. It travels through the ligamentum teres, which attaches right there at the fovea capitis to supply blood to the entire head of the femur. So if there's some sort of obstruction along this path here and the head of the femur ends up not getting enough blood, then that could result in some avascular necrosis and death of the bone. So I'm going to put the pelvis back. And our next couple arteries that we want to talk about are the gluteal arteries. So we have the superior and inferior gluteal arteries. I'm going to spin this around so we can visualize this better. So as you know, our glutes will sit back here. Let's start with the inferior gluteal artery. The inferior gluteal artery runs right real close to the inferior gluteal nerve, supplying the gluteus maximus. And then if we come back here to our right internal iliac, we can see the other branch right here is the superior gluteal artery coming off of there. And this again sits right in between, like a sandwich, the glute min and the glute medius. And that'll supply those two gluteus muscles. Now that we've gone over the internal iliac artery, we'll move to the external iliac artery. And this one will continue down through the pelvic girdle. And once it crosses this line right here, where the pubis and the anterior superior iliac spine, or the ASIS, sits, where the inguinal ligament stretches across, it has a name change. And this name change is the femoral artery. And the femoral artery, appropriately named, sits right next to our femur. And this is the major branch that supplies the leg, okay, as it continues on down. The femoral artery has one major branch that we have to talk about, which is branches off posteriorly. This is called the profunda femoris, or the deep femoral artery. And as you can see here is the visualization. It branches off posteriorly to supply the hamstrings back here and the posterior thigh muscles. Now, the profunda femoris also has some important branches that we would need to talk about. It has these two major branches. It has the medial circumflex femoral artery, we'll start with. It's known as the medial because it branches off medially in the body, and then it'll continue to run posteriorly to wrap around the head and neck of the femur to supply the femoral neck and the femoral head. It's called circumflex because it circumflexes, kind of coursing around that bone there, as you can kind of see posteriorly and combined there. And then the other branch, if we go back to our profunda femoris, laterally we have our lateral circumflex femoral artery. And notice how this sends a bunch of branches again around the head and neck of the femur. This actually combines with the medial one to form a complete loop. And this supplies the blood required for the femoral head and neck to supply the bone with nutrients, get rid of waste, and also support the production of red blood cells in the bone. Coursing on back to our main road, the femoral artery, we will continue down. You can notice how it courses medially all along the leg and the thigh there. And as soon as it courses through the adductor magnus, where there's a hole called the adductor hiatus, and the femoral artery and vein both go through this hiatus, and it'll actually course posterior to form the popliteal artery, which is back here. And so right here is our popliteal artery after it coursed through that adductor hiatus. This is the major artery in the back of the knee and gives rise to some important arteries that supply our knee joint. So there are 5 major branches of the popliteal artery, and they're all called genicular arteries, and genu is Latin for knee. It's appropriate because this supplies the knee joint. And we have a superior medial genicular artery, superior lateral genicular artery, and remember the fibula is over here, so this is lateral. We have a inferior lateral genicular artery and a inferior medial genicular artery. These are pretty easily visualized on the anterior view too. Here's the superior lateral, here's the superior medial, here's the inferior medial, and then here's the inferior lateral. And so they're just named genicular arteries, but they're all just named directionally. And then we have a very important one right here called the middle genicular artery, branching off popliteal artery. This guy supplies your ACL, right? Your anterior cruciate ligament. So this is why when you sprain or tear your ACL during with a sports injury or something like that, the knee swells up extremely fast. It's because this artery, the middle genicular artery, gets ruptured, and it causes that ballooning of the actual knee. And so the main thing you need to know here, again, is the popliteal artery gives off those branches to supply the arterial supply of the knee. We will continue on down through our popliteal artery, and as the popliteal artery continues down through the back of the leg, we have another split point right here. And the split point gives rise to the anterior tibial artery and the posterior tibial artery. We will follow the posterior tibial artery all the way down to the foot, and then we'll come back. So our posterior tibial artery continues down, and then this one splits. There's another branch. This one is appropriately named, is called the fibular artery. And this makes sense as it arises laterally, goes lateral towards the fibula, and again simply just comes on down and then goes down to supply eventually the heel and some of the malleoli. But that is the one major branch there. Going back, we're going to follow our posterior tibial artery down, and notice how it courses medially. And so it's going to course on medial, and it'll course on down, and this goes through the tarsal tunnel along the medial side of your ankle joint to form the major branch as it continues called the lateral plantar artery. So we can actually take a look at that on the bottom of the foot. And the lateral plantar artery, if there's a lateral one, there's a medial one. So there's another branch point that happens from the lateral to form the medial plantar artery again to supply the medial side of the bottom of the foot. Continuing with our lateral plantar artery, that will continue on to form the deep plantar arterial arch of the foot. And as you can see here, that arch gives rise to those arteries that will eventually go to the toes. And so there's a couple sets of them. So we have plantar metatarsal arteries, named basically directionally. They're on the bottom, so they're plantar, and they're right by the metatarsals, so it kind of makes sense. If we follow those, they become the common plantar digital arteries, digital referencing the digits or the toes, and then those become the proper plantar digital arteries to supply all 5 of your toes. We're going to move on back to our anterior tibial artery. We're going to go back to our popliteal where we split and we left our other guy. So here's our popliteal again. And remember, there was one that went posterior. Now let's follow the anterior tibial artery. And notice how this one pokes through the interosseous membrane between the tibia and the fibula and travels anteriorly along the front of your shin. Okay? So this will continue on down in the front of the shin and continue down to go to the top of the foot. And if we follow that artery, it'll keep on coming down to form one of the most important ones is the dorsalis pedis artery. Now the dorsalis pedis artery is dorsal. It runs along that dorsal side and is located right in between the first and second metatarsal. This one is easily palpable. You can feel it right in between there, and it's a common assessment and palpation point for distal pedal pulses or of the foot. The dorsalis pedis artery will continue on down to form the dorsal metatarsal arteries similar to the plantar metatarsal ones. And again, they're on the top dorsal this time, and they're by the metatarsals. That'll then form the dorsal digital arteries and then eventually combine to form the proper plantar digital arteries like we had already established to finish off the blood flow all the way down to the toes. And those are all of the major arteries and their corresponding major branches that supply the lower leg to carry oxygenated blood from the heart all the way down to the tips of your toes. And I hope this helps. I hope you learned something today. Feel free to tune in next week to learn all about the veins of the leg and learn how that system differs from the arterial supply of the leg. If you learned something today, please consider subscribing. It would help me out a lot, and I would really appreciate it. Thank you so much for watching. I am the PT Guy, educating you on God's wonderful creations. I'll see you in the next one.